Hello, today we're doing the second part of the Adrenal USMLE Step 1 questions. So we'll start with some questions and we'll give you the answers and let you try to practice. What age group and gender has the highest risk for developing an adrenocortical carcinoma?
Adrenocortical carcinomas are found in a bimodal age distribution, affecting patients under 5 years old and those in their fourth and fifth decades. Women and girls are typically affected more often than men and boys.
What is the most common cause of primary hyperaldosteronism?
Causes of primary hyperaldosteronism include bilateral sporadic hyperplasia of the adrenal glands as the most common cause, and aldosterone producing adenoma, which is called Conn syndrome.
What is responsible for the physiological consequences of an adrenocortical carcinoma?
Adrenocortical carcinomas are rare, aggressive neoplasms of adrenal cortex cells. Most adrenocortical carcinomas are functional, which means they secrete hormones, secreting any of the adrenal cortex hormones. Glucocorticoids are the most common, mineralocorticoids or androgens. This functionality leads to the physiologic consequences of the neoplasm.
How does an adrenocortical adenoma appear on imaging?
The imaging modalities that most commonly find adrenocortical adenomas are either abdominal CTs or MRIs. Imaging shows lipid-rich tumors of less than 4 centimeters in diameter.
Dexamethasone suppression test interpretation. What does it mean if cortisol levels persistently remain elevated in response to low dose and high dose dexamethasone?
Persistently elevated cortisol in response to either low dose or high dose dexamethasone indicate Cushing syndrome, either due to cortisol producing tumor in the adrenal cortex, high serum cortisol, low serum ACTH. Ectopic ACTH secreting tumor. High serum cortisol, high serum ACTH, most commonly caused by small cell carcinoma of the lung. ACTH levels would be much higher when an ectopic ACTH secreting tumor is present than when a cortisol producing tumor is present in the adrenal cortex.
What is the key difference between 21-OH deficiency and 11-OH deficiency?
11-beta hydroxylase is an enzyme that catalyzes cortisol and aldosterone synthesis, one step after 21-OH. As such, 11-hydroxylase deficiency presents similarly to 20-OH deficiency. However, while the aldosterone precursor that accumulated with 21-OH deficiency 17-hydroxyprogesterone did not have any hormonal activity. The block in 11-beta-hydroxylase allows for synthesis and accumulation of 11-deoxycorticosterone, which has a weak mineralocorticoid effect, resulting in hypertension.